Welcome to ChemoExperts to learn about hair loss. We will discuss what is it, what does it look like, who gets it, and how do we treat it. Hair loss can occur after certain chemotherapy treatments when cells within the hair follicle stop growing. When this happens, hair can fall out in clumps or gradually over time. Hair may not grow back as long as chemotherapy is ongoing. If hair loss happens, it typically begins about 2 weeks after chemotherapy is started, but ranges from 1 to 3 weeks. After chemo, hair can fall out in clumps while brushing your hair, in the shower, or hair can be found on your pillow after sleep. Along with losing hair from the top of the head, you can also lose hair from the arms, legs, pubic area, armpits, eyebrows, and eyelashes. The likelihood of hair loss happening depends upon which chemotherapy agents are given. Intravenous chemotherapy medications such as these contribute to hair loss more so than most of the oral chemos. However, not all IV chemo causes hair loss. In fact, many chemotherapy medications do not cause or only rarely contribute to hair loss. Do not cut your hair without knowing how common hair loss is with a particular regimen. Although small, oral chemotherapy pills can cause many side effects, including hair loss. However, it is rare for an oral chemotherapy to cause complete hair loss from the head. Losing your hair can be a very distressing side effect. Some patients choose to cut their hair short or shave their heads before starting chemotherapy in order to avoid large clumps from falling out. General hair care tips include brushing with a soft brush, washing hair only when necessary, avoiding a curling iron, rollers, bleaching, or coloring. You may also consider trying a satin pillowcase or cutting the hair short to make it easier to put on a wig. Eventually, hair will grow back when chemotherapy is complete. Sometimes it's even a different texture or color. Some patients choose to get more than one wig. Ask a nurse or social worker for valuable information on where to obtain one. Wigs may be fully or partially covered by your insurance. If interested in a wig, ask your doctor for a prescription for a cranial prosthesis, which is the medical term for a wig. Then submit the prescription to your insurance company along with the receipt for the wig. Some alternatives to wigs include hats, scarves, and head wraps. But if you decide not to cover your head, be sure to protect it with sunscreen. Some oral medications may help with hair loss. Additionally, topical agents such as minoxidil or Rogaine may lessen the severity or frequency. Your doctor should be consulted before trying any of these options to make sure they are safe with your chemotherapy and other medications. Hair loss isn't always preventable from chemotherapy, but several options exist. But know you are perfect however you look, with or without hair. Subscribe to our YouTube channel and tell us what you think. Click pause now to read our disclaimer, and thank you for watching.